Hello and welcome to this edition of EC3 HOSA Medical Moments. Today we have Melissa Phillips, who is with our Lincoln Trail Health Department in the area health department. They oversee a number of counties, and Melissa has been one of our regular guests on this show. And in fact, we started this entire program to deal with the COVID epidemic and what we needed to do, and we really needed to get information out to people daily, weekly, monthly. And so the health department has been so responsive, and that's what we're here to talk about today. Not only COVID, but also flu, immunizations, and clinics, because health and all the ramifications around it is something that, as conscious community supporters, we need to share information and keep people safe. So, Melissa, let's jump into the flu.
Okay.
What do we need to do? And where are we at right now with cases?
Right now, for the last 3 weeks, at least in our district, we have been in a decline for case rates, so that's a good thing. But there are other pockets of the state that still haven't seen that, so that means we can't let down our guard just yet. So my biggest advice would be, if you haven't gotten your flu shot, it's not too late. We will do those as long as people want them, because the flu season goes all the way through April. A lot of folks probably don't realize that. And I think the spike in flu we saw this year is largely in part due to the lack of vaccination, because our flu vaccination rates are down, and then people are just not using their COVID precautions like they were, and we know those were effective against respiratory illnesses, so that's kind of led to a spike in flu.
Well, and in the school district, like us, if we have a run of flu in a school or in a district, we have to think about, do we need to close that school just briefly for NTI? And it's not just the students, but it's all those supporters too, teachers, classified staff, child nutrition, drivers, all of those elements. Thankfully, we haven't had to do that so far, but I'm assuming that industries have the same issue, and department stores, all of those things.
Yeah, it really has affected not only schools, but the business world as well. And I think there's a misconception that the health department can set standards for when they should close, and that's not true. Each individual entity sets those thresholds for themselves, so KDE doesn't even set it for the whole school system. Each individual school system, sets their own. So it's a really good idea for schools and, private industry to think about those mitigation efforts, because they really do work.
Have there been any deaths in the area that you all oversee from the flu?
At this point, we have had 2 deaths in the Lincoln Trail District associated with flu. But as a state, and I do have those numbers for you, we've had 114 flu-related deaths.
Now, do you think that's because maybe that person had suffered from COVID prior, or it's just they have some respiratory issues, and when the flu gets there, it's...
There have been a few, it's less than 5, that it was a co-infection of flu and COVID. But if you have underlying health issues and you're not vaccinated, it really does put your risk at a higher level.
We're in COVID right now, so tell us a little bit about the COVID issues going on.
So COVID numbers are much better, but that doesn't mean that COVID is gone. I think COVID is something we're going to live with in our world now. So again, if you haven't gotten that vaccination, or you're not up to date on your vaccinations, because there are new updated boosters, we strongly encourage you to follow through with that.
And where can they get those boosters?
Pretty much anywhere that you receive other vaccinations. At the health department, we do offer flu vaccine free of charge, and we do offer all the different levels of COVID vaccine free of charge.
Oh, wonderful. Is that also with, so if you took one shot, do you need to stay in that regimen? If you had like the Pfizer or the Moderna, or Johnson & Johnson? Do you need to stay?
We do not offer the Johnson & Johnson at this point. Most physicians do not. They'd like the mRNA vaccines, the Moderna and the Pfizer. But it's really a matter of preference. You can mix and match once you get to the booster level, but most people prefer to stay with that same manufacturer.
And it's really easy to get a booster, right?
It really is.
It doesn't take any extra time, but getting the flu shot and the booster, or the flu, not flu shot, but I guess so, immunization, and then the booster, I would say don't do them on the same day.
It's allowed, but it would make probably a more difficult recovery, so I would space those out personally.
Yeah. If you've had one booster from last year, should you wait? I mean, right now they haven't said anything in regards to getting a fifth booster or anything along that line. Is that correct?
With the boosters, it's really specific to your circumstances. So age, risk factors will determine how many booster doses you need. So if you're immunocompromised, you'll need a different number of doses than if you're 6 months old.
What else about COVID do you need to let us know?
We're always keeping an eye on new variants. There is one that's being watched at this time. Kind of the progression is if something's going to start, it starts in Asia, moves to Europe, and then moves to the States. So we kind of see what's happening on that side of the world to kind of prepare here in America.
Well, we know we're going to have that wave because China's numbers have really gone through the roof.
And they lifted a lot of restrictions due to public demand, and you can see what happened when that happened. So,
well, and like you said, when you have large crowds together and none of them practicing some of those things that you may need to, there's going to be a lot of spreading.
And that would be a recommendation. I know everyone wants to say we're done with COVID, but
and we want you at those ball games, but
if you are going to be in a large indoor gathering, it's probably a good idea to wear your mask, especially if you have any underlying health concerns.
And hand sanitize, wash those hands, and things
cover
like that.
Those sneezes, all of the things.
Be aware of your community around you. Let's talk about immunizations. We mentioned those. We're having a little bit of a lull, and we really need to push those.
So COVID really did harm our childhood vaccination rates. It was really hard to get to a physician's office just because of circumstances. So a lot of our littles are really behind on their vaccinations. And I pulled a little bit of data for you, and this is Hardin County specific. And we looked at toddlers, 2 and 3-year-olds, and less than half have completed their childhood immunization series. So, that's over 50% of our littles in daycare and preschool who are not fully immunized. So, that could lead in a emergence of measles or other diseases that we had pretty much eradicated. Mm-hmm. And then I looked at teenagers as well, and for flu shots, only a quarter of them have had their flu shot. So when you talk about high school and sporting events and middle school and all of that, very few of them are immunized against flu. And then if you looked at meningitis, only 19% are vaccinated.
Wow.
So, and our rates are lower or comparable to state rates here in Hardin County for vaccination.
Do you think that there's a disconnect with parents? Maybe they're not trustful of immunizations, or, what do you think that trend is?
There may be some of that, but I think that lack of access to health care really harmed a lot of folks, especially a lot of our folks who had barriers anyway. It's really hard to get back into that routine, to find a physician again, to make that connection again.
And most immunizations, they are covered by your health insurance or K-CHIP. There are many programs so there's usually not a cost.
Correct.
To those. And I know that we have nurses in our schools mm-hmm. that can also provide those immunizations. And I went to my pharmacy to recently get my boosters. So those are available. Thanks.
So yeah, there's lots of ways to get them. Your health departments, your school clinics, if you're blessed to have those, your pharmacies, your physician's offices. So especially for COVID and flu, there's really no excuse not to have your immunizations up to date.
The last time we were together, we mentioned RSV and what that is and how detrimental that can be to infants and toddlers.
And thank goodness that really did hit a spike in Kentucky, but that has now on the decline. So we're very thankful for that because it was really affecting our littlest Kentuckians.
Now, I know adults can also get RSV. Is that correct?
Correct.
Okay, and I guess if it's a person that does have some compromises, respiratory compromises, that could affect them as well. Maybe it wouldn't be RSV, would it be another type of illness?
It's still RSV, but any of these respiratory illnesses, all of the mitigation efforts we used during COVID help. So, keeping your distance, gathering in small groups, washing your hands frequently, wearing the mask when you have to be close to other folks that don't live in your home. All those things work.
Yeah. What about the clinics that are coming up?
So we're pretty excited. As of the 9th, our clinics are back open to normal business. We had been, limited staff, limited number of days open, limited number of services, but we're back on track now. We think that it's safe to do so. So one of the biggest reasons we made that decision was childhood vaccination rates. We want to get those babies back in there and get their vaccines updated.
Now, where are the clinics located?
Here in Hardin County, it's on Westport Road. We always tell everybody, if you know where the Social Security office is, you can find the Hardin County Clinic. So they are open 5 days a week, normal business hours, and some of the services that we are providing again, we never stop providing WIC, so that is always available. And if you're not familiar, that's the Women, Infant, Children's Program. It's a supplemental nutrition program. STD testing and treatment, TB testing and treatment, childhood vaccinations, which we just talked about, and then vaccination for flu and COVID for adults.
Do they need appointments?
Yes, and I can get you the phone number for that as well.
We'll show the website too. We'll show the picture. Now, in the other counties that you serve, they can easily go online and find.
Correct. You can visit our website to get contact information for any of our clinics. You don't have to live in the county to receive services in that county. So something else that we offer, we have 3 syringe service programs. So we do not have one in Hardin County at this point. They are in LaRue, Nelson, and Marion. But again, you don't have to live in those counties to use those services. And through those, you could receive hepatitis C or HIV testing, free Narcan, referral to treatment for substance use, and we have a peer support worker.
Oh, wonderful. So is that something new that you all have added?
The first one was in Nelson County. We've probably had it 10 years or so. And then we picked up Marion County, and our newest one is LaRue County.
All right, wonderful. And can people from Hardin County go to those locations?
Absolutely.
So you can.
And that's not something you need an appointment for. You just come and you're seen, and you can be on your way.
Now you all have some really nice websites or Facebook things that people can interact with. Important information. Do you still keep the page up for the teenagers or younger people?
We do. We have reworked our website a little bit. The teenagers and young adults have their own section. We're on all the socials: Twitter, Instagram, Facebook. We have dipped our toes into TikTok, so you can follow us on TikTok now. And one other thing I wanted to mention is something positive that came out of COVID is we have a new mobile unit. It's brand new. We're still kind of feeling out our communities to see what services they need the most. But at this point, we're reaching out to our underserved populations and offering vaccination. So look out for our green and blue van.
And those, where it's going to be, that'll be posted?
Mm-hmm.
So people will know. Okay.
Yes, we have somebody that's over that program, and she's working on promotion of that as we speak.
Wonderful. Well, Melissa, thank you for coming in. And for those of you, please check out the Lincoln Trail District Health Department information. Follow those guidelines. Wash your hands thoroughly. use hand sanitizer, sanitize, wear your mask when you're going to be, especially when you're going to be in large crowds and things. So, Melissa, I appreciate you coming in. And now we're going to go to EC3, where you're going to meet some students that are involved with our HOSA program. Hello, and welcome to this special edition of EC3 HOSA Medical Moments. Today we're on location at our Early College and Career Center in our Health Sciences Lab. Joining me today is Mr. Kenneth. He is one of the patients that the students in the Health Science Department get to experiment on daily. So he's been through a lot, but he's a real champion. Today I'm joined by two of our students that are involved with our health sciences. Both are students at Central Hardin High School, and they're involved in our HOSA program at EC3. We have Brenna and Meadow. And so, Brenda, I'm going to let you introduce yourself. Tell us a little bit about what grade you're in, what your pathway is, and your role in HOSA.
Well, I'm Brenna. I go to Central Hardin. I've been going to EC3 in their program since I was a freshman. So far, I've got my certificate in medical administrative assistant, my CPR certification, and I'm working on getting my nursing assistant certification. And in HOSA, I'm the secretary for.
Wonderful. Okay, and Meadow, now your turn. You are a junior, correct?
Yes, I'm Meadow. I have my certification for CPR, and I'm working on getting my nursing assistant.
And what role do you have in HOSA?
I am a co-treasurer because there's two of us.
For those that do not know, what does HOSA mean? What kind of an organization is it?
HOSA is a program for kids that want to be future health professionals, and they're working on their skills to get to where they need to be or they want to be so they can meet those goals.
Now, each year, your HOSA organization chooses like a theme or a topic, something to promote. Am I saying that correctly, or is it like a project-based learning?
We go to different competitions, and we each have our own events. So me and Meadow, we're both in the community awareness, and right now we're working with Be the Match. It's a bone marrow donation, and that's our little event.
Okay, this is a long process for you. So a number of the students are involved in skills tests and project tests. So again, for the audience, Brenda, tell us a little bit about some of those skills tests.
The skills tests range from, you got CPR, you have your phlebotomy, you have your basic nursing skills, and it really just ranges from even the little classes that we have here.
And some are topic-based, correct? Similar to your
yes.
project where they're presenting information, sharing information. And Meadow, tell me about some of the other project-based that the crews are doing.
We have mental health groups that will provide services and awareness, and we also have a vape prevention group.
Brenda, how has this experience with HOSA helped make you more of a successful student?
It's really helped me be more confident in my words, really in general. It's helped with me being a leader and being the secretary as well.
Meadow, why did you all choose bone marrow match as your topic, as your project?
It's really diverse in our community, and we're trying to get more people to be donors on the National Registry. It's really low.
Mm-hmm. Now, is it a complicated process, Brenda?
No, it's pretty simple. Our age range is 18 to 40, and if you are below the age of 18, there's an option to pre-register, and then on your 18th birthday, you would then be contacted to register, and you get a cheek swab sent to your house, or come to one of our events, and we would give you a cheek swab, and you do that, send that to Be the Match, then you're fully registered, and you basically await to see if you're matched with anybody.
As part of your project, the two of you, along with Reagan also, you all put together a public service announcement that we're showing in our community. And you talked about events that people can also come to. But for our audience at home, I want you to take a look at the video, the public service announcement that these students did recently.
Hi, my name is Reagan Scarborough, and I am with the EC3 HOSA Club Community Awareness Project. Our goal is to raise awareness as to what blood-borne cancers are and how we can raise the amount of donors. In each of our community and school events, we hope to have an honor wall. And to complete that, I want to ask a simple question to you, our viewers. If you or someone you know has come in contact with a blood-borne cancer, we ask that you send in a picture of them so that we can honor them through our honor wall. Thank you.
Hello, I'm Meadow.
Hello, I'm Brenna.
We are the Community Awareness Team for EC3 HOSA, Future Health Professionals. We want to share the importance of bone marrow donation, helping those in need to find his or her life-saving match.
We've joined this team to further our knowledge as well as share insight with others. For thousands of people diagnosed every year with life-threatening blood cancers like leukemia and lymphoma, a cure exists. Be the Match is an organization operated by the National Bone Marrow Program that works to help people with blood cancer find the life-saving transplant they need.
Our community awareness goal is to inform people of the need for more bone marrow donors on the National Registry. We plan to meet this goal by raising $2,000, getting 100 people to agree to completing a cheek swab, along with hosting 3 community and 4 high school awareness events. To become registered on Be the Match, you will need to scan the QR code and complete a series of simple questions. For in-person events, a swab kit will be provided and collected once the questionnaire is completed. For completion of the questionnaire at home, you'll receive a swab kit in the mail. Now you're one step closer to becoming a match.
Be the Match accepts donors in the age range of 18 to 40. If you are under the age of 18, there's an option to pre-register. On your 18th birthday, you will be contacted to either get a swab kit at home or come to one of the events. If you are over 40, please consider making a monetary tax-deductible donation on our Be the Match team page. For individuals over 40 with a strong desire to join the registry, an organization called DKMS will allow you to complete a questionnaire to determine your eligibility on their website. DKMS is an international nonprofit that fights against blood cancers and disorders. They will send a swab kit to your home if you are deemed eligible. Depending on ethnic background, the patient's chance of finding a bone marrow or cord blood donor ranges from 29 to 79%. The markers used in matching are related to genetics. Due to the complex tissue makeup in some ethnic backgrounds, a patient's best chance may be from a donor with the same ethnicity. For these reasons, we encourage you to please consider joining the registry. In addition, we ask that you spread the word about the need to increase ethnic backgrounds on the registry.
I am considering being a donor for Be the Match because as someone who has been healthy their whole life, I know it's going to feel good giving back. Not only are you giving a piece of yourself away, but you are also giving a piece of yourself to someone who needs it most. You are giving that person a better and healthier quality of life.
For people like me who are unable to donate for various reasons, I want to support Be the Match to help raise funds for saving lives. Also, I want to volunteer in my community at donation drives and fundraising events. Be the Match uses financial gifts to help patients afford transplants, find donors, and complete groundbreaking research. Every cent, every dollar counts.
Help save a life.
Will you be the match?
So now that we've got our audience all excited and they want to participate, where might they see you at these events?
They will see us at high school basketball games. We pick the closest ones that we can, and if they're away games, then we go to the away games.
Right now, you're going to Central Hardin, North Hardin, John Hardin ball games?
Yes.
Both boys and girls?
I think it's just boys basketball.
Okay.
Yes.
And when you go there, you all are you set up in the concession area or?
They would probably most likely see us near the concessions. Maybe tickets. We're not sure yet.
Okay. So, Brenna, explain a little bit about donations and what people can do. Not only donating their swab, but also money and where that money might be used.
It can go towards research, for care packages for the donors and people that are needing that donation, and even to just cover really everything.
Incidental costs and things, gas and things along that line.
Cover their transportation and the whole process.
That's great. And for those students that might be in that 8th grade transition, they're trying to think, what am I going to do? I got to pick a pathway. Why health sciences? Meadow?
Even if you don't know what to do, it's somewhere good to start. You can It's anything from like the basics to knowing some of the terminology, and then you get into your emergency procedures. And even if you're halfway in and you don't want to do it, you can always find different paths here because that's what EC3 is. So,
Have you had an experience in the program so far that's been that joy, or like that, like this is exactly what I want to do and this is why? Have you had that moment yet in this program?
I just started my internship for medical administrative assisting, and just being able to be a friendly smile to the people that walk in is just brings joy to me, and just knowing that I was able to at least make them smile today and be able to just talk to them just a little bit.
Awesome. What about you, Meadow?
I'd say that I have. Last year or 2 years ago, we had some difficulty with my mom having COVID, and I had these classes to help me, and then it got kind of real on me, so then I had to use what I learned to help her.
That's great. That's great. So you both are definitely going to be successes. Okay, so, and I wish you well on your project. And so those of you, when you see these nice young ladies out at basketball games, Central Hardin basketball games, please consider giving a bone marrow sample and become a bone marrow donor. We're also going to be meeting with another of the students that are participating in this program too. So we'll be talking to Reagan about her experience as well. Gina Ryan here again. We are in our studio now for EC3 HOSA Medical Moments, and joining me is a wonderfully young health services student that is currently involved with our program. Reagan, tell us a little bit about yourself.
So I'm Reagan Scarborough, a senior at Central Hardin High School and a sophomore at the EC3 Academy program. I'm involved within the Beta Club at Central Hardin, I-Lead program at EC3, and HOSA Club.
Why do you like being so involved?
I believed that being so involved is almost a way of giving back to like your school. You know, they give you so many opportunities and they're right there at your fingertips, and you can do so much for your school and your community.
What health science classes have you taken and certifications that you're pursuing?
I've taken all the certifications up to becoming a CNA and medical terminology and emergency procedures.
And what is your goal in 5 years?
My goal in 5 years is to graduate from Western Kentucky University with a doctoral in physical therapy.
Why physical therapy?
I think it's just something I've always enjoyed. You know, there's a sports medicine side to it, so you're not right there at the bedside. You get to see people come in hurt, but then you send them out well, and they're able to go back to whatever they want to do and they love.
Now, you are the president of HOSA, so tell us a little bit about HOSA.
HOSA is Healthcare Occupation Students of America, and we are a healthcare organization where we take kids to competitions and we train them in something that they love in healthcare in hopes that they will pursue that in the future. We also are very active within our community, especially at small offices and places that really do need donations and help.
And you're involved in a project that's coming up for the state conference, correct?
Yes.
Okay, talk about that.
I am a part of the Community Awareness Project, and this year we are focusing on bone marrow diversity and the lack of donations that are within our community and nationwide.
And how are you getting your message out, and how can people donate bone marrow?
So we actually have a link online. There's a few of us in our group that have put that out there. We're also going to all the 3 local high schools and setting up, really trying to get the grasp of the younger age groups. And let's see, I think we're also going to set up at a few churches.
Why is that important to you?
I think it's important to me because while I've never been affected by it, I know that someone has, and I've seen the videos and the stories, and one transplant can give someone the rest of their life or maybe 5 more years.
Well, congratulations on all of your wonderful accomplishments and getting this project kicked off for our community. I think it's going to be really valuable.
Yes, me too. Thank you.